who spends an enormous amount of time highlighting those things. You could say how they'd be very reluctant to have you support him.
I would say that's an understatement. Yes.
Yeah. So what do you do to stop that from getting in the way?
Well, look, they've come up with some amazing things. I mean, I don't know how you feel. I know you're against certain vaccines, but like the polio vaccine, people had polio. It was like a disaster. And they came up, Dr. Salk, and he came up with a vaccine, and there's no polio. Now, very interesting, there hasn't been polio, but now in the Gaza Strip, can you believe that? Have you heard that? There's been a big strain of polio coming out in the Gaza Strip.
Is it vaccine-derived polio? Because, you know, there's a strain of polio that comes directly from the vaccine, because unfortunately sometimes when you vaccinate people for polio, you actually give them polio.
I haven't heard that, yeah.
Yeah.
I mean, all I can do is I sit down and I listen to him, and I'll give it a total. I would love him to be right, because if he's right, it's a lot less expensive generally speaking.
There's two things that people point to when they point to the dangers of the pharmaceutical drug industry. One thing is when pharmaceutical drugs were allowed to advertise on television. The other one's New Zealand, but they're more restrictive than we are. People are worried.
Those ads, when you hear take a certain drug,
and then you hear all the consequences.
And then you say, it causes cancer and baldness. We don't like baldness.
Suicidal
and
ideation.
And this and that and eyesight, and you can lose your vision.